你在家中风了，那么需要有急救人员把你送到医院，这个 paramedics is the first group， 它是第一批我们的这个需要用到的一个联合健康的这个专业。然后呢，你到了医院之后，除了医生的治疗之外，那还有这些语言病理学家帮助你恢复说话。那么有这个呢 OT 职业诊疗，帮你恢复一些正常的生活工作的功能，穿衣服、做饭呢，在家里移动。Hello， 大家好，我是健身老师。今天很高兴我们有请到 ECU 大学的医学健康学院的执行院长和主任 Moran 老师。他是一个澳洲的注册医生同时呢也从事很多Allied Health 这个专业的教学。现在很多中国的学生和家长问到我一些关于到澳洲学习跟医学健康有关专业的问题但是我觉得澳洲的这个医学健康有关的专业，它的职业分布名称学习的内容工作的模式和中国是有很大不同的。那我们今天就有请呢 Mary 老师跟我来共同分析解释一下这些职业的区别要求和对咱们中国留学生在澳洲就读一些和医学健康有关专业的一些建议Mary 老师懂一点简单的中文，那我主要是用英文来跟他在中间进行采访。First of all, it's my great honor to have Professor Moran here. So you are working as a doctor in Australia and you also teach many life health occupations in ECU. So first of all, could you please explain what majors are there in the field of life health in Australia? Because in China, we don't have a very equivalent name or major in this area.
When someone becomes unwell and they go to hospital, there are many different people who will be part of their care. If we take an example of someone who has a stroke, let's say my mother has a stroke and suddenly she can't move one arm or she can't speak. Okay. In Australia, what we would do is you would call the ambulance, emergency ambulance, and the people who come out will be emergency paramedics.
Paramedics.
The paramedics will be people who have trained for emergency and they study for 3 years. They are one of the allied health professionals whose job is to get people to hospital safely, quickly. They also can give drugs because they can make an assessment of someone and say, this is the problem, this is the emergency drug we must give them. And then they can save lives before people go to hospital, and then the care continues in the hospital. So when you turn up in the hospital, then there is another person who goes to see you. So you will see the doctors, you will see the nurses. Then let's say they've diagnosed you've got a stroke and you go in, then it will be some of the other allied health who will see you. So for example, we have the speech pathologists who will help with learning to speak again after someone has had a stroke. And that's very important because if you don't treat people when they have lost their ability to speak, they will get depressed, they will be socially isolated. Then there is the OT whose work is to help work out what are the important things you need to do in life and how to help you do that. So it is the OT who works on who are the people who are important to you, how do you communicate with them, how will you feed yourself, can you lift up to feed yourself, will you be able to put your clothes on, will you be able to go to the toilet, will you be able to cook.
So where do they work?
They work
the patient's
in
hospital,
as well as they will also visit the patient's home to make sure that they are safe. Then you also have the dietitian, so nutrition and dietetics goes together. And because after you have a stroke, it's possible that you've done something so it's difficult to swallow. You need special meals to stop the food from getting into the lung. You need food to be in the right way. And it's possible that if you had the stroke, maybe you had diabetes before you had the stroke. So it's that you may have to have a good diet that reflects what you need there. So dietitians can work in hospitals. They can also work in the community. Then we also have, there are different types of people who work with musculoskeletal. Physiotherapy, osteopathy, chiropractic. These are people who work with musculoskeletal. And they can help people walk again, be stronger after disease like stroke and injury. So there's some of the allied health. We also have allied health practitioners who are involved in diagnostics. So we have medical sonographers who are the people who do the ultrasound imaging so that if someone is having a baby, they will often have a pictures of the baby. That's done by the sonographers.
Ultrasound,
And also when someone has appendicitis, we will often check the appendix using that. or gallbladder, gallstones. Again, we check it using ultrasound. So there are many different types of allied health, and they are all very highly needed in Australia and around the world. So all of our allied health practitioners get jobs everywhere.
就是摩尔教授呢，给咱举了一个非常合适的例子。他从一个这个中风的病人，你在家中风了，那么需要有急救人员把你送到医院。这个 paramedics is the first group， 它是第一批我们的这个需要用到的一个联合健康的这个专业。然后呢，你到了医院之后，除了医生的治疗之外，那还有这些语言病理学家帮助你恢复说话。那么有这个呢 OT 职业诊疗，帮你恢复一些正常的生活工作的功能，穿衣服、做饭呢，在家里移动，以及呢也有这个物理治疗师帮你恢复一些骨骼、神经、肌肉的这个能力。这个也包括了营养学家帮你去调试一些特别的食物，来适合糖尿病人呢他出院的一些恢复的这个注意事项。有蛮多这些工作都在整个链条中间帮助病人恢复呢。就除了 doctors 医生之外，有一系列的联合健康辅助健康的从业人员来进行工作，帮助病人恢复。这个在澳洲是划分的非常仔细的。
魔力留学深耕澳洲数十年，与各大学院系关系密切，与各行业人脉互动频繁。快关注我们的账号，咨询澳新申请吧。